a Derby City South team. So we cover a range of GP surgeries. So on the North team, we cover Horizon Healthcare, Macklin Street Surgery, Wilson Street Surgery, Osmaston Surgery, and Derwent Medical Centre. On the South team, they cover Melbourne, Chaddeston, Hollybrook Surgery. So between us, we cover quite a few surgeries. So we are non-medical. We take referrals primarily from GP surgeries, but we also do accept referrals from other professionals. Even self-referrals. A lot of the GP surgeries do have online self-referral forms that patients can fill in themselves. Like I say, we cover anything non-medical, so anything social. So maybe anyone suffering from loneliness and isolation wants to get out and join a group. Anyone struggling with their finances, not sure what benefits they're entitled to, they're in debt, just struggling financially, that's something we can support with. Health and fitness, we work with Derby County Community Trust, we can make referrals into them. Also the More Ways GP Exercise Referral Scheme. Anybody wanting to volunteer as well, we work with the Volunteer Centre next door at Community Action. We can make referrals into there for anyone who's interested in doing some volunteering. Anybody maybe wanting a befriender, want help with shopping, little things like that, that's something we can support with. We work with Disability Direct. We work with befriending services, the Good Neighbours scheme, where we can refer people in. They will set them up with maybe a telephone befriender or a face-to-face befriender, or like I say, little jobs around the home or help with shopping, things like that. Housing issues as well, we can help with things like that. So someone's struggling with their housing situation, maybe they've got damp, they're behind in their rent, they feel their landlord's not being supportive, or they've been issued a Section 21 and been told they need to move. That's something that we can help with as well. We are not based in the surgeries, we're based at Community Action. We have a team of 12 of us. We also have an advice worker who used to work at Systems Advice, who helps out with housing and financial issues as well. We do have a day in the GP surgery once a week where we build up relationships with the staff there and we can see patients there. We do primarily do phone calls, so we would accept a referral from the GP surgery. We would give that patient a call. We are patient-led, so it's about what matters to that person, what do they want. So we will have that conversation with them and then try and signpost them into another service that might be able to help them better than us. We do home visits if someone's housebound, or we feel that a home visit might be more beneficial for them, we can do that. We can meet people out in the community. So we can meet them for a coffee, take them to libraries. If they want to go to any groups and they're a little bit unsure at first, we will support them then first few times until they get there and they make connections. We kind of say that we work with people for maybe 6 to 12 sessions, but there is no limit on how long we will work with them for. Everybody's different. So if somebody's maybe homeless, we might need to work with them a little bit longer to ensure they've got all the support they need. Some people, it might just be a couple of phone calls because they want to go out to groups. We can signpost them to groups. The next time we call them, they might say, yep, it's great, we've been, really enjoyed it, we don't need any more support. So that's kind of it really of what we do. We work with anyone, like I say, we do get a lot of referral for newly diagnosed cancer patients as well, for young mums, anyone suffering domestic abuse or violence. We work with a lot of groups as well and services in the city, and we are more of that signposting service, that we're not experts in any area, but hopefully we can signpost people on to get the support they need. We work with people with low-level mental health, so we can refer into the IEP services like Talking Mental Health, Trent PTS, Derby City Lifelinks, things like that. So it is about just that non-medical. So maybe somebody's going to the GP because they want another fit note, but it's about finding out why they need that fit note, what's going on. So maybe then the GP can refer into us so we can have that more in-depth conversation with them obviously we're not just a 10-minute appointment. We could be on the phone to somebody for an hour or even longer, however long they need, and we will support them till they feel they've got all the support in place that they need. So I'm just wondering really if anybody has got any questions that they would like to ask.
If anyone does have any questions, you can just pop them in the chat box as we go along.
Okay, so in Community Action, our team of social prescribers, there was 12 of us. So our manager is Sammy, who can't be here today. I'm the senior social prescriber. We do have another social prescriber who works on the complex needs team, and she's based at the council office. But me and Sammy, my manager, we also have a caseload as well.
So we've got another question that says, can our service refer into you?
Yes, absolutely. If we always say if the patient can contact the GP surgery and ask them, so they don't need an appointment with the GP, or reception staff should be able to make a referral. But I know some people find it really difficult to get through to the surgery. So if you're happy afterwards, Alice, I can send you the surgeries that we cover and mine and Sammy's email address, and then you can give them out. And if anyone wants to refer in, send an email to me and Sammy, we can put the referral on for them.
That's great. Thank you.
So the waiting time before contact, so every day we check the GP surgeries and we pick up the referrals, and they're allocated to a member of staff on that day, and we aim to contact them within 5 working days.
Anybody else have any more questions for Sarah?
Yes, we do befriending. Like I say, we use it is with volunteers. So the Good Neighbours based at Community Action, they do rely on volunteers that are all DBS checked. Sometimes because they're volunteers, it can take a while. They tend to like to match the person up with somebody maybe with similar interests that can go and chat to them, that they'll know they'll get along with. So sometimes that can take a while, and it can be face to face or it can be over the phone, whatever the patient's comfortable with. And we also use another Good Neighbours befriending service. So we have got options that we can use. So yeah, if somebody wants to attend a group and needs support, we are more than happy to go along with them, meet them there, walk them in, introduce them to other people until they feel comfortable. I think there was another question came up, but I think I missed that one.
Can you send some info to us that we can share with the carers that we speak to?
Absolutely. Like I say, we have leaflets. We also as well run our own coffee mornings across Derby. So we've got one in Willington in the Village Hall. We've got one at Simfin allotments that we work with Derby County Community Trust. So they do a little bit of gardening, but there's also a summer house in there where people can just go and have coffee and biscuits if they want. There's one at Chester Green. There's one based in the council house at the Better Together Cafe. There's one at Mackworth Community Centre, the Pakistani Community Centre, and also the Heart of the Park Cafe at Arboretum. I will send them coffee morning posters to Alice and our leaflet, and then Alice can send them out to you. Okay, so was that a question about when I'm at GP surgeries, do we see patients?
Yeah, are they able to drop in when you're in location at GP surgeries, Sarah?
Absolutely. Yeah, like I say, when we go to the surgeries, we do send a message out to the staff to let them know that we're there. So if they have any patients, they can send them to us. We're there mainly on a Tuesday or a Wednesday in the north, and in the south, it's on a Thursday. So yeah, if somebody wants to come and see us in the GP surgery, they're more than welcome to. And I think our coffee morning in Wellington has turned into more of a little carers group, because I think Malvina found that the people that were coming were mainly carers. So it does have more of that carers focus, because the majority of the people that attend are carers.
Did you say that was the Willington group, Sarah?
That's right, yes.
Yeah, we'll get copies of the posters and leaflets sent out to everybody as well today.
Yeah, absolutely. Is there any other questions?
Thank you, Sarah. It doesn't look like there's any questions.
Okay.
Oh, somebody's just asked what time and day is the Willington group?
Okay, so our coffee mornings normally run once a month. And I think, let me just double check for you when it is. So the one in Wellington is the last Wednesday of every month at 10:15 to 11:45.
And can people just turn up to this group as well?
Yeah, so all of the coffee mornings, there is a social prescriber there. Obviously, if somebody wants some advice, but they're not just for social prescribing patients, they're for anybody to just drop in, just for that, if they're maybe feeling a little bit isolated and lonely, just for that social interaction, or if they want some advice around anything. And if it's a surgery that we cover and they'd like a referral, if they're happy to provide their name, date of birth, and what surgery that they're at, then we can make that referral for them, and we can pick them up with it, like I say, within 5 working days. I think our team as well, between us, because we're not linked to a GP surgery and we're based in the office, we've kind of got a wide range of skills between us. So my background is education and family support. Kate has worked as an IDVA in domestic abuse. Haroon, Tim, and Gary have all worked from drug and alcohol services. Sammy, our manager, has been the manager on the homeless team at Derby Homes. Sidra and Haroon have also got, that community language speakers as well. So between us, we've kind of got a lot of experience between us.
Well, that's really useful to know. Thank you.
You're welcome.
Does anybody else have any more questions? And if not, I can stop the recording. Okay, I'll just pause there.
Oh, Vicky, you're welcome. Thank you for all the referrals.